Today we're here with the CSU Podiatry team and we're going to demonstrate an equine digital venogram. I'll let the doctors take it from here. So here's the tourniquet. It's important to get a good tight tourniquet. This horse has already been blocked, so it can't feel its lower limb. As you see, she puts the tourniquet nice and tight and controlled, and that's because we want to keep the blood down in the foot. What the venogram is going to show us is the vascular anatomy and how things change with different disease processes. So if we ever have a question, whether is this horse have an abscess or is it actually laminitis, the venogram will be one of the best diagnostics that we have. We can do this stall side, so it's an easy, fairly simple procedure. Once we secure that tourniquet, she'll be then catheterizing the palmar digital vein. But executed perfectly. We then put an injection cap on. And then here's our contrast. This is special radio opaque contrast. We'll inject about 24 cc's in a regular size horse. Our first view will be a lateral radiograph. That'll give us an initial sense of the way the foot is statically. Then we'll go to a dorsal palmar view. Then we have an assistant come in and pick the leg up. This view is important as it shows the unweighted view of the foot. This will give us an idea of where the vascularity is when there's no pressure on it. And then we go back to our late lateral shot. This is probably the most important shot for a lot of diagnostics because this is after the foot's had a chance to equilibrate. And it looks like we got a good solid venogram. Can take the tourniquet off and put a Band-Aid on the leg and we're set. After completing the venogram, we're able to assess the vascularity of the foot. Just a few things that I'm looking at when I'm trying to decide what's wrong with the horse. I look at where the blood flow is, if it's in normal anatomical positions. I look at these small structures here that are the papillae. That's what's growing your primary horn for your foot. I'm then checking the sublamellar plexus and to see how tight it is. That could be a sign of laminitis or some other pathology if it's thickened. I then want to see this corner here that we call the circumflex lamellar junction. I want to see it nice and distal to the apex of P3, which it is. And then I take a look and I see more of these paintbrush structures, and that's what I want to see. Those are your solar papillae growing your sole in your horn. And this horse looks like it's in good shape. It's got a good amount of sole and its vascularity is all intact.